And like three themes have kind of like emerged, and it's kind of like we just go into the same conversation. One is stigma, the other is resource and advocacy. Stigma cuts across, and why I continue to do this work when I really want to retire to DR. Something happens, somebody calls me. So I work a lot with the faith communities, and a young lady called. She had an 18-year-old who just came out, and this is about 2 weeks ago. An 18-year-old was raised in the church. He decided to come out. He came out to his grandmother, who he lives with. His grandmother took him to church, and they put the oils and all that good stuff on him. And when he woke up the next morning, he was still gay. So grandma threw him out. So this is an 18-year-old, so the church, at least there were some church members who knew me, and she called and said, what can we do with this kid? Because they told him to go to Bellevue. So 18-year-old young man, gay man, just identifying going to Bellevue men's shelter might not be the best idea. So we have resources, and that's what some of the work that I like to do, is be able to call somebody and say, help, I need to get help for this kid. So the stigma is, because he's going to be stigmatized, he may put himself in harm's way. He may go sell himself for a bed, for a place to live, and put himself at risk for HIV and AIDS.
So when it comes to advocacy, I think the past few years has been really difficult to many of our providers because of the number of cuts that the providers see, and also the amount of service reductions that the community needs to endure. And I think we are finally coming out from a very dark tunnel. And the tunnel, at first when it started, when the Great Recession started in 2008, and then 2009 and 2010, we've seen so many cuts, not just on the federal level, but state level and then city level. We've lost so much. So I think what the community needs to feel energized again is that think of the success and accomplishment that you are able to achieve. New York is actually the only state in the whole country that managed to have a 40% decrease of new HIV infection. No other state in the country are able to achieve this goal. 40% decrease of new infection is a big deal. And injection drug use used to be the risk factor of more than half of the cases in New York State. We are able to bring it down, and there has been an 80% decrease. You talk about prenatal, mother-to-child transmission. There are only few cases this past year. So the decrease is more than 95%. Mother-to-child transmission is less than 2%. Great. So the point here is that we need to celebrate the success, and we actually have enough success stories to tell, to say that we are really ready to put this epidemic truly under control. A few of the panelists mentioned earlier today that the New York State AIDS Institute has developed a plan to end AIDS. What FPWA is working on at this point with our coalition partner is that to develop a city version of it. And what does that actually mean by ending the AIDS epidemic? We need to find out where the gaps are. According to the HIV cascade of New York State, there are roughly about 20,000 people that are supposed to get tested. They're probably infected, but we don't know where they are. So getting that 20,000 people confirm their HIV status is very important so that they will not unknowingly transmit the disease. Now, within the population, 130,000 people in New York State live with HIV, but only 46% reach a virally suppressed status. So, meaning bridging this connection from knowing your infection to become virally suppressed, it's going to be the goal moving forward. The State Department of Health AIDS Institute is thinking about how to bridge this gap. And I think the community has a lot of knowledge that can help to inform them how to connect people to care and how to achieve a higher care retention and treatment adherence goal.
Vocal New York, Voices of Community Activists and Leaders, we're a grassroots, community-based, membership-led organization serving to build power among people directly impacted by HIV/AIDS, the war on drugs and mass incarceration, in order to build more healthy and just communities, right? We feel like people who are directly impacted by those issues need to be in the conversation when we talk about policy and legislation, right? Because too often what we find is that legislators, despite the fact that they have come from these communities or represent these communities, usually are disconnected once they get involved within the political institution. So it's our charge as community individuals and leaders to make sure we hold them accountable by keeping them informed about what's going on at the grassroots, at the ground level, right? So my job as an organizer is to make sure that people who have been disassociated from the political process gets re-engaged, right? Because they're the ones who's going to be impacted the most or the least by these policies that are being created, right? So this is specifically my charge as being the HIV/AIDS community organizer. As we've seen with the statistics and the turning of tides, that HIV/AIDS has now been concentrated in low-income communities, particularly communities of color, right? We're seeing that over 90% of new infections are with communities of color, black and brown communities. And more often than not, we look at the social indicators or factors like housing, mass incarceration, drug use, and homelessness are also what has perpetuated these rates of infection in our community, right? So it's my task to help not only educate, but to motivate people to get engaged in a process that not only empowers them to talk to legislators, but also help them to become the change that they want to see in their community. So there's a lot of issues that we try to focus on. I'm trying to figure out how did HIV now become concentrated in low-income communities of color, right? So early on, we recognized that it was drug use, right? So we had syringe exchange. People had to fight for those, right? And we also recognized that it's housing, and we're still fighting to look to have our legislators recognize that housing is not only HIV prevention, but it's a form of health care, specifically for people living with HIV and AIDS. We have seen over the years that when people are stably housed, that they're more likely to take their medicine on time. They're more likely to practice harm reduction. They're more likely to perform high-risk behavior transmission, right? And they're able to live a longer, more productive lifestyle, right? So we recognize that housing is a necessary intervention for not only to keep people negative, because even when we look at LGBT youth who are having transactional sex on a pier just for a place to sleep, we recognize that housing is not only just an intervention, it's also a prevention method as well.